Okay, good morning, ladies and Lake Charles and Southwest Louisiana. This is Mayor Nick Hunter. Today is Thursday, March 26th, and we're talking with some individuals who are really on the front lines of this city's response to the coronavirus, COVID-19. I am so inspired by not only what government's doing locally, but what our nonprofits are doing, and the response is amazing. Let's start out with introductions. Jackie, go ahead and introduce yourself and tell just a little bit about your job description.
Good morning. I am Jacqueline Green. I'm the Executive Director for the Calcasieu Council on Aging here in Lake Charles, and we're happy to be with you this morning.
Thank you, Jackie. Denise?
I am Denise Durrell, President and CEO of Southwest Louisiana, United Way of Southwest Louisiana, representing the 5 parishes.
Okay, and Leanna?
My name is Lieutenant Leanna Marion. With my husband Thomas, we're the administrators and pastors for the Salvation Army here in Lake Charles, Louisiana for the 5 parishes.
Excellent. And before we get into the meat and potatoes, I have great respect for all of you. I consider you all friends, and I've got to ask, and let's go in the same order, starting with Jackie. Jackie, how are you doing? Is your family okay? Office is getting through this as best as possible?
Yes, sir. We're tired, but we're doing well. I am blessed. My entire staff is still working. No one has called in. Everybody is dedicated to the mission, and we are helping our seniors. Last week, we normally serve around 2,400 meals weekly. This week, we're at about 3,000. We're anticipating by the end of this week, we're probably going to be up to about 3,500. That number is going to continue to grow. We're still serving to our homebound, and we had 4 congregate sites throughout the parish where they could go and eat a hot meal and congregate. We would serve the meal to them warm. We've transitioned those clients because of the social distancing to either drive-through pickup on Fridays, or we are delivering those meals to their homes for them. We are also waiving the signatures where we don't have to actually have the seniors sign for their meal, and any supplies we can get our hands on, we are delivering to them. We're getting calls daily for toilet paper, bottled water, cleaning supplies. We're working with our state governing authority to get as many supplies as we can, and we're also working with our local providers to hold some things back for us so we can get the things we need. And Rouse's has been a wonderful partner for us. So they're holding gallons of water because the 24 packs of water are so heavy, we would have to try to go into the home with those items, and we're trying not to enter the home. So just a gallon of water is a little easier for us because we're primarily ladies, and it's easier also for the senior to be able to get into the house. And so we're doing a gallon of water, and we're bringing in 5 to 7 days worth of frozen meals, plus everything they need to go with their meal so that they'll have something healthy and nutritious to eat while they're home during this time.
So Jackie, just knowing your heart and the heart of your staff, I'd be willing to bet that right now, if there's a senior in need in Calcasieu Parish, you're going to move heaven and earth to find a way to make sure that that senior gets that need.
Yes, sir, we are. So no matter what they call us for, and that's year round for us. If it's a service that you see in my brochure, or if it's a service that you do not see in our brochure, we will find a way to meet the need. So right now we're getting calls for things that we don't normally do. Distilled water to help with oxygen pumps, medication pickups, just some people having trouble reaching their doctor's offices. So we're making phone calls, and our senior centers are closed. So what my senior center coordinators are doing, they're doing telephoning. We're calling our seniors who would normally be out at our senior centers every day to make sure that they're not getting depressed or that there's an unmet need because they're stuck in the house that we can help them with. So we're not just sitting idly. We still have a job to do, and my staff is dedicated to that job. So I'm encouraging the community, if you know of a senior or if you are a senior and you have a need, call us. We're going to help you meet that need for any senior in our parish who needs our help.
Okay, let's move on to Denise. Denise, how are you holding up? How's your family? How's your staff? And maybe talk a little bit about how the last couple weeks, especially last couple of days have been different for you guys?
Yeah, we're doing okay. From a family perspective, my mom is isolated herself. She does live out of town, so we spend a lot of time on the phone just making sure that she's okay. She actually had to go to the doctor this week, and she said she was the only one there with gloves and a mask. So I was really proud of her. This morning, we actually had a situation that we had to experience. My daughter here in Lake Charles has a dog, and he started having problems last night. And so she's actually been sitting at the vet clinic all morning while she had to do the out of the car thing. So that was a new experience. We hear about that, that's what they're doing, but for her to actually have to go through that. So I know she's really worried about him, and it's only that much more difficult that she's sitting in the car in the parking lot but we know that he's in good hands. And so we're praying that he'll be okay. Our team has been phenomenal. We did offer, work from home situation, remote, so that people could work remotely. And I have to say that every day we have 3 folks who have young children, and so they have decided to take advantage of that. But they're all still working, but everybody else is showing up every day. And our phone is pretty much ringing off the hook with people needing assistance. And so even our front desk person is showing up every day. And she's helping to funnel those calls. And so I'm just so proud of each and every one of them. I know they're all exhausted, but they, like Jackie's team, we're in it. We're in it to win it. And so, they're just so dedicated, and I'm so thankful for that. Life has been very different than the norm. We, over the course of, we're really good at raising funds, and we have some initiatives that we run ourselves, but 211 is one of our programs. But when we're in disaster mode, it ramps to 24/7. And so that has been a major increase of our work. As a system, we're handling like almost 30,000 phone calls and that many text messages. And so keeping up with the data has been really a challenge. And I know our 211 director is exhausted, but she's still, she was here, I think at 4 this morning, just completely dedicated to making sure that that's updated so everybody gets the right information. And then the other thing is just, it's been, we're kind of on steroids, I think, right now. The things that we normally do, we partner with people on a regular basis. But in this situation, when we have seen need and we've collaborated with some, including these 2 lovely ladies right here, to figure out a way to fill in that need. And then we're just reacting. And so we're definitely acting on steroids these days. But the good news is that I think we're making some wonderful impact in the community, because we're trying to make sure that everybody, right now, we're focused on making sure everybody gets fed. And I have to tell you, I'm sure, just like you, Mayor, we know our seniors are covered because of Jackie and her team. So they've never been a worry for me this entire duration. I've told everybody, Jackie Green has got our seniors covered. And so we really changed our direction to make sure that kids and the other adults and our homeless folks out there, that they all have access to food as well. Most people may not realize that in Southwest Louisiana, our average is that 1 out of every 4 child is food insecure. And in the rest of the country, it's 1 in 6. So we're actually in a more dire situation here in Southwest Louisiana than the national average. So we know that without crisis, we've got folks who are hungry. And so this is just really an increase. And so we're just partnering, calling on our partners to ask them to step up and do what they do best, and then allow us to do what we do best. And it's been proven to be some really incredible collaboration. So.
Excellent. And Lieutenant Marion, I'll tell you, this has been a very difficult time for a lot of nonprofits, and some have had to adjust what they're doing. Some have had to, unfortunately, pause some of the actions that they had done in the past. And we understand those challenges. I've got to say, God bless the Salvation Army right now and what y'all are doing. I'm so inspired by you guys right now. Y'all have really stepped up, and I just want to thank you for what y'all are doing. So just talk to us a little bit about how are you doing? How is your family? How's the staff over there? And then, of course, tell us a little bit about what y'all are doing different today that perhaps you haven't done in the past.
Thank you, Mayor. So here at the Salvation Army, normally we would have our social services open. We would have our thrift store, family store that just opened for the public. But right now, we have canceled all social services except for our hot meals that we're serving through our soup kitchen, our shelter, which is still running 24/7, and our emergency food pantry, which those who are affected by COVID can call in, make an appointment to come and pick up a food box. Our staff from our store, because we've had to close our thrift store, they have moved over to our shelter and are helping us prep and serve the community those meals. So we were able to temporarily move their positions to kind of keep their jobs and keep their insurance going for them. Personally, we have 2 little ones. Our son, who's almost 3, his daycare has remained open, so he is still able to go to daycare, so that has been a huge help. But we have our 3-month-old daughter, who was born in December, late December. She's been coming to the office with me, so she's actually sleeping right next to me currently. And she doesn't have daycare because she is breastfeeding, so she's with me every day. We try to get her inside as much as possible, but of course, some outside work. My husband has been cooking. He's been helping to cook. He's used to serving in disaster situations for the Salvation Army, so he has been doing a lot of cooking. Most of our staff are great, are good. We've only had 1 staff member from the store who had to step away due to her health concerns. She didn't get sick now, but she has prior health concerns. She's the at-risk population. So she's not here. She's not out serving at this time. But their families are good. We have not had anybody come down sick. So we're blessed by that as well. And a lot of the men who stay at our Center of Hope, our 30-bed men's shelter, they are out of work. So they are volunteering their time to help serve, to help direct traffic, to help get meals together and ready for the community. So that's been a wonderful, wonderful thing to have. We have an increase in our meals. Just this morning for breakfast, we went from an average about 20 served for breakfast to 40. Yesterday, we had an increase of 75 from our normal, what we had been normal, I'll say that way, serving. So we served just over 100 people yesterday here. And then today, my husband is taking our mobile kitchen to Sulphur. And just all of the food, I have to say, all of the food that we are able to serve right now would not be possible without Freshco, without United Way helping us with the funding for that, without Texas Roadhouse. Ideal Lease brought us a reefer truck to even put everything on. The school board, Calcasieu Parish School Board, has brought trucks and trucks of stuff to us. And with our community around us coming together, that's how we're getting it done. Today specifically, Hunt's Brothers Pizza is serving, they can serve up to 400 meals here at our Legion Street address today. So
and Southwest Beverage also donated a truck we were able to call them, and they donated a truck for Leanne and them to use as well. So
yes, so we have that as well. So we've had just so many people from the community itself, through Denise and United Way helping us, and through people contacting us directly, who have been just bringing and donating stuff. So that has been amazing.
Awesome. Thank you, Lieutenant Marion. Denise, I want to go back to you for a minute. Since I have been mayor, I think one of the greatest tools I have encountered is 211 to try and get people connected to resources locally. And that's part of the purpose of this video. And a thing that I try to do is we need more resources, but sometimes people just don't know.
Right.
Already out there and available to them. So would you mind talking for just a quick minute about what 211 is and how people can use it?
Sure. 211 is an information and referral service. And basically, we take information about what all the services are in our region, and we make sure that they're put into this database. And then we have certified call specialists, United Way call specialists, who answer the phone. And so they go through the story of the situation of what the person is dealing with, and try to get to the root of any of the services that they could benefit from. And so any individual can call 211 from a landline or cell, or you can text 898-211, and you will also reach a 211 operator. But you can ask for anything, whether you have just lost your job, you might need training, you might need information on obtaining your GED, or you can't pay your light bill, you can't pay your rent or your mortgage, your car broke down, transportation. A child may have just been diagnosed with something and you want to make sure that there's a support group. Any resource that is out in our community, we try to make sure that it's included, and we do it in real time. So, like for example, if we happen to have flooding here, which we do unfortunately on a pretty regular basis, and let's say the city or the parish is offering sandbags, well, we put into the 211 system. So if someone calls and says I need sandbags, we'll be able to tell them exactly where to go to get those sandbags. But let's say we run out of sandbags, then the next person who calls in will not be told to go where there are no sandbags. So we do it in real time. So and that's one of the reasons why our team works 24/7. They're monitoring every website, every television, every media outlet that you can imagine. They're monitoring the city's website, the parish's website, any way that we can obtain information, so that we make sure that all the resources are, number one, in the system, that they're updated, and then all of the changes are made in real time. So, and like I said, we took over 211 in the beginning of 2017. And the other thing is that it's now 24/7, 365. So, I know for me personally, if I have a crisis or something going on in my life, I want answers right then and there. And it may be 2 o'clock in the morning, but I want an answer. And so the great thing is that our community can access 211 day or night, even on Christmas Day, where we don't close. And the other thing that I don't think a lot of people realize, with COVID-19, we are partnered with the Department of Health and CDC, and so we're actually answering all those non-emergency questions that people have. But I also want you to know that United Way of Southwest Louisiana also funds a crisis call center. So if you are in crisis and you want to talk to a specialist, or you actually can call 211 and they will transfer you immediately to the call center, where a licensed professional will take your call. So we actually handle the non-emergencies, and all the way to the crisis. So we run the gamut. So we just try to make sure that we can be of complete service to the community. 211. We want everybody to help us spread the word, because you're right. So many people don't know about 211, and so many people don't know about the services that we provide. But if you just call them, the operators will just slowly take you through the process of what's going on in your life and be able to plug in things of services that might be able to help you.
Thank you, Denise. Jackie, let's circle back to you. If someone needs your services, if someone needs some help from CCOA, how do they get in touch with y'all? And then also, for those people who want to help CCOA right now, what's the best way for them to do that?
They can call our main office, and I actually hear my Second Harvest truck backing in. So I'm ready to run outside.
Nice.
But my staff's out there. They can call our main office at 337-474-2583. And I also would like everybody to know that we are still transporting. We've got a lot of cancellations with the doctor's offices and some of our clients that are non-emergency medical. But for the majority of our transit, which is 80% dialysis patients, we are still transporting our dialysis patients 5 days a week throughout the parish. And what we're doing is we are having them sit every other seat, one per seat, and nobody sits directly behind the driver. So we are taking precautions, but if we don't transport them to dialysis, how are they going to get there? Who's going to take them? So I just wanted and if you have a medical appointment, a senior or a disabled person in the community that you must get to, we're going to get you there, even during COVID-19. So call us and we're going to find a way to pick you up and get you there. We're kind of bypassing all the long paperwork. that we normally do with the state office. They're telling us, do what you need to do. And then once this is all over with, we'll go back and sit down in the home with the client and get all the paperwork taken care of. Just meet the need right now. So that's what we're doing. So we do want to let them know we're still transporting our dialysis patients and those who have medical appointments that they need to get to. I am going to find out today if I can drive them through the testing site, the drive-through testing site. I haven't called yet, but I'm getting ready to find out if I can drive them through the drive-through testing site. If someone feels like they need to be tested, if I can drive through the testing site. If we can, we will. We'll drive them through so they can be swabbed and tested and bring them right back home. So that's another thing I'll be checking on today. What do we need? I have some amazing people who have called to volunteer. We don't need them yet because my staff is just showing up every day, but I have a list ready to go. I just told my ladies, they're looking kind of tired. So I said, do y'all want me to ask for gallons of water on Facebook? I said, because y'all know if I ask, because our bingo hall is closed and we have a little canopy, I said they can drop it off. So they said, not yet. Let us continue to rock and roll, because Rouse is, the Carlos site, he puts stuff in the back for us before he puts it out. And then we drive through and pick up what we need from him. So far, so good. And again, we're helping them with whatever it is that they need. Just making sure they have toilet paper. We're doing the gallons of water. We can't get our hands on cleaning supplies right now, but we're encouraging them just to maybe dilute bleach with water, or the old-fashioned pine salt with water works. The majority of them are homebound. So we're saying do not let anyone enter your home that could possibly contaminate you at this time. Just stay isolated. Try to read the paper. Oh, we're going to be passing out word search puzzles and crossword puzzles in the next couple of weeks. We had to get creative. So we're going to copy them here and put them in envelopes and tape them to their food boxes so that we don't have to make any contact with them again for safety. So we're going to be putting highlighters with those to make sure they have a highlighter to do those with. So just little things, you know, that mean so much. I'm just trying to think of everything I can to try to help them. And a lot of our clients also receive free newspapers from the Lake Charles American Press. So their newspapers are still being delivered every day, and they can read their paper.
Thank you, Jackie. Lieutenant Marion, let's go back to you. If someone needs your services, how can they get in touch with y'all? And then if people want to help, how can they help the Salvation Army right now?
So if they are in need of an emergency food box, they can call our phone number, which is 337-721-8068, and speak with Tina, our social worker, to get an appointment scheduled to come and pick up a food box. It's by appointment only, the emergency food boxes. If they are in need of a hot meal, they can come to our location at 3020 Legion Street. The bus does drop off right down the street from us. And we are serving breakfast at 6:30 to 7 a.m. We are serving lunch for the public at noon to 1:30 p.m. And we are also serving dinner for our shelter residents. Public, if they are wanting to help, there's a couple different ways that they can do that. First, if they're coming here for services, the first thing they can do is practice their safety, practice their precautions. Come here if they need masks, with masks. If they've been quarantined and they come here because they need something and they're leaving because they need food, those people, I ask that they let us know that they are quarantined when they come, that they are doing all that they need to do to protect themselves and our staff as well. Gloves, face masks, hand sanitizer, those kinds of things. If they can do that in advance of coming, that would be great. The things that we really need the most is really cash donations so that we can purchase food. United Way has been awesome in helping us with that so far, but we need help to purchase that food on a long-term basis until April, whatever, when we are able to go back to normal. We are getting a lot of donations in the way of produce and milk. We do not need those things. What we really need for food is meat, any kind of meat, but we need it in large quantities. So just a small thing of hamburger, a little 5-pound thing is not going to be as helpful as a larger donation of ground beef, 20, 50 pounds, something like that. Even if it's chicken nuggets, today we got chicken nuggets donated by Hunt's Brothers Pizza to cook. And so that is enough for a meal for us to serve. But they brought like cases of chicken nuggets. Right. And so that's the thing that we're really needing the most. And then if they want to donate money, they can do that in different kinds of ways. They can mail it in. They can drop it off at our address here. They can get it to United Way. United Way will get it to us because that's what we're really trying to do. On a long-term basis, that's what we need.
All right. And Southwest Louisiana is such a caring community. Everyone that can right now, I know they're waking up thinking, how can I help? And we need to be nimble with resources, you know, and you mentioned, Lieutenant Marion, a moment ago, it's food this week, but it might be something else next week. And so really, I think the encouragement is before someone goes out to the grocery store and just buys a bunch of stuff and drops it off with Jackie or at Salvation Army, if you can do it, the donation to a fund is the most nimble and probably the most needed resource right now. Even if it's $5 or $10, you know, that could actually be more effective than going out to the grocery store and buying something that we think people might need. So Denise, talk to us a little bit about the special fund that United Way has set up.
We are collecting donations specifically for people affected financially with COVID-19, and it's open. You can just go to our website, unitedwayswla.org, and find the button there. 100% of all of the money that's coming in for this effort will go straight to help people who are financially affected, whether we are buying for food to help groups like Salvation Army and Carrie Baptist group for their feeding site, or helping our Alice neighbors who are folks who are, you know, either now underemployed or not employed at all, or have a financial burden unbudgeted, such as a daycare situation that they normally wouldn't have, and they're hourly employees. We have actually received over 75 applicants so far that our team is caseworking, and our goal is to be able to help those folks as well. So we just, you know, we have the fund set up. They can donate again to our website, again, mail it to us here at 815 Ryan. But what we're doing is, you know, we let, like for the Salvation Army, they go and we connected them with a food supplier. They place the order because they know what they need. And then she just sends me the invoice. And so when we're processing that. And I would like to say that in addition to that, we know that these food suppliers are also, their businesses affected as well, because some of their large clients are not opening and operating right now. And so we actually have the system set up so that Sister Leanna sent me some invoices, and the very next day we hand delivered the checks to the company, because we know we're hearing from them too, and they're more than willing to do this for us. But we want to make sure that we're not putting them, because these large orders are not coming in from some, and now got them scrambling looking for food, for product, and so we're doing that as well. So, but you're right, we're able to look at the need and act pretty quickly. And so if anybody could contribute, we would just greatly appreciate it, because we're going to turn around and 100% is going to go to agencies such as Calcasieu Community, you know, the Council on Aging or Salvation Army or Carrie Baptist, or the people who are really on the ground doing the boots on the ground work against COVID-19.
Ladies, I've got to mention there are dozens of nonprofits in our area that are doing such good work. If we had tried to have this conversation with all of them, I think everybody would have been allotted about 45 seconds. Yeah. So I want to acknowledge there's so many others that are out there doing great work that aren't included on this conversation. Thank you to everyone that's out there doing hard work. Let's wrap up this conversation with just a few parting words. perhaps a message from you or your agency to the community. Jackie, let's start with you.
We just want to thank Southwest Louisiana. I tell people all the time, it's a wonderful place to live. It's going to pass. And when it passes, we will look back and say, what a wonderful partnership. Everybody's been so accessible. The VOAD conversation yesterday, conference call was amazing. We have some amazing things coming online this week. I'm just grateful and feel so blessed to be a part of everything that's taking place. I don't feel panicked because Southwest Louisiana is always ready where we live to handle any type of situation. So I just want everyone to be encouraged. Again, if you have a senior citizen that is in need or know of a senior citizen that is in need, please call us. If I cannot assist them, I will call someone who can help me to assist them, Denise and several others in the community. And thank you, Mayor, for allowing us this platform today. And again, we're looking forward to brighter days in the next couple of weeks and months.
Amen. Thank you. Denise?
And you're exactly right. There are so many agencies out there doing tremendous work and who are all a part of our VOAD group, the Volunteer Organizations Active in Disaster. Yesterday, we did have a conference call because, again, we're practicing social distancing. And we'll have another one next week. And it really is amazing to have the public and private sector come together, all those nonprofits that are active, but also those governmental agencies like the city, like the fire department, like the sheriff's department and the police department, all coming together to hear each other about what we're doing, how things are going, and what any needs that they have. And it's kind of like these little miracles just start popping up and people are connecting in that meeting. And so we're going to continue those on a weekly basis. And so we know we've got some really great people out there doing some really incredible things, and we're so fortunate, and we're just consider ourselves honored to be a part of it. And thank you, Mayor, again for giving us this opportunity to share. And if there's anything that anybody, any need that anybody has, please call 211 or call us here at our office at 433-1088. We're here to serve, and we're in it to win it. So.
Thank you, Denise. Lieutenant Marion.
We just want to tell people that, the mission of the Salvation Army is to preach the gospel and to meet human needs in His name without discrimination. And so I want people to know that if they are sick, they can still come and get what they need. If they have any kind of preconceived anything about the Salvation Army, I just want people to know that they can come here. They can call if they are in need. We're not going to discriminate against you if you have COVID. We're not going to discriminate against you if you're homeless. We're here to help everyone. And we're able to do that only by cooperation and partnership with people like United Way, with the mayor's office, with all of those who have donated so much to us. We only can do what we can do because this community of Southwest Louisiana is backing us. We're the middleman, and so we are so thankful.
Thank you. I'll tell you what, if someone doesn't feel a little bit uplifted after this conversation, I think they might have been watching or listening to something different than I was. Y'all are doing amazing work, ladies. Thank you. Keep it up. We'll get through this together. Thank y'all so much.
Thank you. Thank you, guys.
Mayor.
Thank you.